Hello, I'm Dr. Brandt Gibson, and I'm here today to talk to you about gout. So you've heard about gout, or maybe you haven't, but really gout presents as a red hot swollen foot. And it can be pretty painful, severe pain in some situations. And a lot of times you're saying, okay, what's causing this? Why does it even happen? So what I'd like to focus a little bit on today is why you're getting that increase in uric acid crystals in the body and in the joints. And gout will present in three different areas. You can get asymptomatic gout, where you have high uric acid crystals in the body, but they're not depositing at the moment. Number two is an acute attack, red hot swollen area, where you get the uric acid crystals depositing in a joint, can cause pretty significant pain. Reasons that can happen is you get a spike in the uric acid crystals, you get an injury or problem in an area so that the crystals migrate to that area. All of those can actually lead to it. And the third is a chronic gout. And a lot of times in that case, you'll get uric acid crystals where they kind of just deposit in that area, and you get bumps all over the place that when you open them up are really just deposits of uric acid crystals. And they can actually be pretty problematic, pretty painful, and can even ulcerate if they get big enough. And that's something we have seen. So again, why do you get gout? Most people think of it as the rich man's disease. You say, okay, their wines, cheeses, red meats are the common possible causes. And they're not the only thing. Diet absolutely affects this, but even high amounts of carbohydrates can actually cause this. High amounts of any types of protein can actually cause this. Any foods that have high purines in them will cause this uric acid crystals in the body and so forth. So that's one of the reasons that can happen. You can get a metabolic syndrome where you say, okay, I have high blood sugars or high cholesterol, I have obesity, blood pressure problems. All of these together can actually cause an increased chance of having uric acid crystals in the body as well. If you have kidney problems, so if the kidneys are not working like they're supposed to, of course, you're not clearing out the uric acid or the urates, and so they will actually become uric acid crystals, and they deposit in the joints as well. You can get medications. The thiazides and loop diuretics can both cause an increase in uric acid crystals. Even low-dose aspirin can actually be a cause of these uric acid crystals in the body. Chemotherapy type treatments can cause gout attacks, as well as diabetes. So if you have a diabetes and you have a tendency for these uric acid crystals being high in your body, for example, they're going to actually deposit, and you're going to have more of these gout type attacks. Hypoparathyroidism can cause this. Psoriasis, not just a skin problem, but it can also cause these uric acid crystals to deposit in the joints and cause those red hot swollen symptoms. Lead, especially lead toxicity, can actually cause this uric acid type deposit in the body. Toxemia in pregnancy, and of course the biggest one is genetics. Now with gout, the problem could be genetic, where you actually have a problem getting rid of urate, or it could be a problem where you overproduce it. Either way, you'll start to get these gout attacks and these gout symptoms and gout problems. So there are multiple treatments that can be done for this, but the truth is really just need to determine if you have it. If your foot is not red, hot, and swollen in that area, then gout is usually ruled out. That's not usually what the problem is. So gout is going to present that way, and then you can say, okay, let me go get it evaluated, get it treated, and get some options so you can really find a solution for your gout. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 379, gout and how it will present, so that you can actually decide, do I need to go see a doctor and get it treated? If you'd like additional information, reach out to us at utahfootdoc.com. We'd love to talk to you. We'd love to help you. Goal here, get you back to doing the activities that you love without pain.